The outbreak in Vanuatu started on Saturday, the 5th of March. We were told by the Minister of Health that there was a breach in the quarantine protocols. That was the information the minister gave, that there was a breach in the quarantine protocols, and that was how it ended up in this outbreak.
And who breached these quarantine protocols?
No specific names was mentioned, but we were told that there were probably visitors going to the quarantine and to visit maybe friends or relatives. And after that, it seems that after that visit, it seems that this is how it all started, when they came back and started having contact with other people. And then one of them got sick and went to the hospital to check up, and that got tested and had a positive result. And that's how the story started.
Yeah. And how quickly is it spreading, and what sort of response has there been?
It's spreading really fast. Since Saturday, they did some contact tracing, and they realized it was really we had a community transmission. So they decided to do a lockdown for the whole of the island of Efate and the capital city of Port Vila. Then they start to bring people in through their contact tracing procedures, and they find that we were getting a number already out there in the communities.
Yeah.
So it was spreading quite fast.
Vanuatu has been pretty impressive in containing the virus. Is there concern that this may change the dynamic?
Yes, in fact, a lot of the members of the public were quite surprised that we had this situation. So there's a lot of panic going around, and uncertainty because this is really new for us. And even with a lockdown, it's going to change the dynamic of things at the moment, when we have all these businesses closing down, and especially a lot of women, they're doing their market businesses. They depend on those for income. Those are also shutting down at the moment. So we are expecting to see some effect in the coming days or months.
Yeah, and I imagine that's already happened, Dickinson, given, Vanuatu is so dependent on tourism. There would have been a lot of pain throughout the community.
Yes, you can see, even in the social media, you can see this is being expressed by a lot of people. So, yeah, this is something that we are anticipating. We hope it's not going to lead to another disaster, but we can see the potential.
How are you able to help the community?
For Vanuatu Red Cross, we are helping the Ministry of Health very closely with this vaccine rollout. We have been helping them in the past few months, but with the outbreak, we are still continuing with our assistance to the ministry in the vaccine sites, awareness to the community, and we are managing the hotline from 8 to 5 each day. We have our volunteers managing this hotline. A lot of calls are coming through. People are uncertain, asking questions, so the lines are really busy. We also offer psychosocial support, supporting the public health with the psychosocial support to those who are currently in quarantine, to try to, just help them out.
And what is the level of vaccination in Vanuatu?
We have a lot of people going and getting vaccinated, but with this outbreak, we realized that even in the capital city, a lot of people, quite a number still are not getting it. So you can see the queue at the vaccine sites. People are queuing up trying to get vaccinated.
Well, Dickinson, we hope that it is contained fairly quickly, as we know, because resources are limited. We do appreciate your time. Thanks so much.
You're welcome. And yes, we do hope everything will be sorted out as soon as possible. Thank you very much.